Parasites. Wellness influencers and TikTok in general love this topic, so let's talk about an actual parasitic illness which is kind of making the news: Chagas disease. So Chagas disease is a parasitic illness caused by the Trypanosoma cruzi protozoan, which travels inside the kissing bugs, which is a group of different bugs that we find in different parts of this country. And through that bug, it gets transmitted to you. So how does it get transmitted to you? So basically they're called kissing bugs because they can bite you on the face. Eek. But that's not the worst of it. So when they bite you, they drop their feces on your skin, and in that feces you will find a little protozoan parasite. And because of the skin break, the feces and the protozoan in there gets inside. So what happens when this parasite gets inside? Well, you start getting sick. You get a local reaction, something called a chagoma, which is like a little bump, a little ball of parasite protozoan inflammation getting in. And then once it gets inside, it can seem like a kind of respiratory, not respiratory, like a viral infection. Fevers, malaise, kind of feeling down, not well, right? Kind of vague, non-specific symptoms, which is why it's easy to miss early in the phases. But once it lingers, it can cause a whole host of other problems. One of the things I've learned, which I totally forgot about, is something called Romana sign. So this is kind of colorful and not for the faint of heart. If the protozoan enters through your eyeball, like through your eye, it'll puff up your eyelid, and that's Romana sign. Yes, a parasite entering through bug feces through your eyes. Now back to the original story. If that protozoan floats around in your body for weeks and months and does not get caught or treated, it can start invading different organs, and that's where the serious stuff happens. It can make your spleen enlarge, it can cause your liver to enlarge, it can affect the nerves of your body, causing pain and neuropathy. It can affect your GI tract and affect the nerves of your GI tract, and it's cause something called megacolon, which means the colon is just not functioning properly and things just build up because you can't push the stool through because the nerves have been damaged. The other really serious complication of Chagas disease that is untreated in the body is that it affects your heart wall muscle. So it damages your heart muscle, and then your heart muscle becomes weak, which is what we call congestive heart failure. In fact, if someone comes in with congestive heart failure and we have no idea why, and it's not the usual suspects like coronary disease, heart attacks, alcohol, the things we routinely look for, we kind of have to think about Chagas disease as a reason for congestive heart failure. Not common, but it's in the differential. And of course, congestive heart failure has all sorts of ramifications, from symptoms to arrhythmias, lots of serious things from that diagnosis itself. Now, this is pretty easily treatable with anti-parasitic medicines. The problem is, it's not that easy to catch early because it's just not something we routinely think about. And the initial symptoms are kind of vague, like fevers, malaise, that type of stuff. So in summary, parasitic